Tantor Audio, a division of Recorded Books, presents The Quest for Sexual Health: How an Elusive Ideal Has Transformed Science, Politics, and Everyday Life, by Steven Epstein. Narrated by Steve Menasche. Introduction. Catching Sexual Health. Move Sexual Health Forward is the slogan of the 2019 National Sexual Health Conference, which opens on a sweltering Chicago summer day in the over-air-conditioned recesses of the Marriott Downtown Magnificent Mile. A volunteer hands me my registration materials, which include a name badge, a program, and a T-shirt in my pre-selected size, inside a bag displaying the conference logo on one side and the logo for the pharmaceutical company Gilead, the diamond sponsor of the conference, on the other. No relation to the sexually repressive Republic of Gilead, the brutal, theocratic police state depicted in Margaret Atwood's dystopian fantasy novel The Handmaid's Tale. Gilead Sciences Incorporated is known in this setting for selling drugs that can prevent or treat HIV infection. I take advantage of the time left before the opening session to peruse the already crowded exhibition hall, where the representatives of 39 companies and groups, Modern Sex Therapy Institutes, Say It With a Condom, the Society for the Scientific Study of Sexuality, Walgreens, have their tables and booths. As I make my way around the room, I help myself to an array of printed materials and souvenirs. Numerous branded condoms, the 2019 Pocket Edition Positively Aware HIV Drug Chart, and a cardboard coaster for the wondrous vulva puppet, which, as I learn later from the website, is the #1 anatomical model used for education, therapy, OB/GYN clinicians, and schools worldwide, and is taking the shame, mystery, and porn out of the conversation of women's sexuality and sex education. While many conference goers chat with eager reps behind tables on the room's perimeter, others check out the poster presentations in the interior of the hall that summarize findings from a diverse assortment of academic studies. She Speaks: Intersections of Intimate Partner Violence and HIV. Overview of Sex Therapy and the Diagnosis of Sexual Functions and Disorders. And Research, Impact, and Empowerment: Reaching Marginalized Youth Through Evidence-Based Intervention to Reduce Teen Pregnancy. As I traverse this space, surrounded by manifestations of the remarkably varied ideas and activities, all somehow located at the meeting point of sexuality and health, it strikes me that this is a domain of action, investment, and intervention. The commercial interests, the service providers, the consultants, the academics, and various others have all come to the Chicago Marriott to explain what they have been doing or figure out how to do things. They all indeed seek to move sexual health forward. The fourth such conference to be held by NELE in the United States, this one has been planned by a consortium of nonprofit organizations and coalitions. In the large, crowded banquet hall, where the conference officially opens, a representative of one of the local hosting organizations greets the crowd enthusiastically and announces that around 900 people have registered for the conference, of whom about 700 have traveled from outside the Chicago area. Those numbers constitute a 44% increase over the attendance at the previous conference in 2017. To my eyes, the crowd appears to skew female as well as young, with a median age perhaps in the low 30s, and plenty of tattoos and piercings on display. It also seems relatively multi-ethnic. Data posted on the conference website, apparently obtained from pre-registration forms, indicates that nearly a quarter of the attendees are affiliated with state and local health departments, and just under a fifth work with community-based organizations. Others are educators, researchers, activists, health providers, and service providers of various sorts. Over the course of 3 days, attendees take their pick of over 100 sessions and roundtables. There is plenty to choose from. Topics include clinical concerns, everything you ever wanted to ask a genital reassignment surgeon but didn't know how, political debates, human trafficking, the truth about modern slavery in America, and sexual exploration. Kama Sutra Cafe. The session titles call out a diverse array of identities and constituencies. Conservative Christians, Jesus and sexual health, Muslim Americans, Allah loves consent and school children, school dress codes, the politics of shame, stereotypes, and sexualization, as well as elderly people, transgender people, and disabled people. After immersing myself in the conference, I come away with a distinct impression of some especially salient themes. First, presenters regularly and routinely remind the audience that sexual health is something more than just the absence of disease. This formulation does not surprise me. As I will explain, it is a riff on the World Health Organization's WHO definition of health in general, and it also reflects the more specific working definition of sexual health that was developed under that organization's auspices. Yet precisely because a high proportion of those drawn to this particular conference, more so than at some of the others convened under the rubric of sexual health, are people who work in the area of prevention of sexually transmitted infections, STIs, and HIV, it seems especially important for attendees to reject a narrowly disease-based approach. Sexual health is an imprecise positive imagined against the backdrop of the fight to wipe out various specific negatives. Second, speakers repeatedly invoke the importance of telling one's story. This injunction sits perhaps uneasily alongside the assumption that claims should be evidence-based. That sexual health promotion should be an evidence-based activity is among the listed goals of the conference, and the conference speakers regularly reinforce the idea. For example, Dr. Debbie Herbenick, in an engaging plenary on the changing sexual behaviors of Americans, makes clear that her facts are grounded in the methodology of the nationally representative probability sample. Yet this emphasis on evidence appears to coexist with exhortations about the absolute importance of all of you raising your voices and telling your personal stories. In the words of David Harvey, the executive director of the National Coalition of STD Directors, who adds, "We learned this from the HIV community." Without questioning the importance of good science and hard evidence, the discourse of the conference seems also to insist on the power of truths that are deeply personal, authentic, and validated by the self. The motive behind this storytelling is presented as a practical one related to the dynamics of advocacy work. The personal is political. Yet I leave the conference with a sense of a vital, if underspecified, link between science and selfhood, and between facts and experiences in the forging of sexual truths. Third, the HIV/AIDS epidemic, with its vast toll of lives lost, stands out as a historical turning point in the evolution of activities centered on the promotion of sexual health. Again, this is partly because the threat of HIV is simply the concrete, workaday focus of many of the attendees of this particular conference. Yet there is much more to it than that, as speakers reference how the fierce political and biomedical crosswinds of the AIDS epidemic swept aside older approaches to issues of sexuality and health, ushered in new forms of health advocacy, and changed the conventional discourse. "We never used to talk about sexual health," comments conference co-chair Dr. Case Rietmeyer in his opening remarks. He goes on to attribute the destigmatization of the entire domain to the profound effect of the AIDS epidemic and the consequent increased attention to sexual rights and sexual justice. Yet, while the epidemic transformed the landscape of sexual politics, the idea of sexual health has also broadened the discussion of HIV and connected it to other concerns. At a lunchtime symposium sponsored by Gilead, the presenter, Dr. Paul Benson, explains that he used to be an HIV doctor, but has come to consider himself a sexual health doctor. Finally, the idea of moving sexual health forward, and the action orientation that motivates the proceedings, is tightly intertwined with contemporary politics and topical debates. The Affordable Care Act and health insurance, the hashtag #MeToo feminist movement, sexual consent on college campuses, the Black Lives Matter movement, the opioid epidemic, restrictions on abortion. The discourse of the conference is inflected by the burning social issues of the day. As speakers draw connections to these and other concerns and criticize dangerous political trends, many conference participants snap fingers in audible displays of solidarity. The point is not simply that conference goers are reacting to all the anxieties and uncertainties of a political moment characterized by the persistent threats and incessant tweets of the Trump administration. More specifically, the claim is that sexual health is implicated directly and indirectly in all these hot-button topics. Anyone who cares about sexual health should care about these issues, and anyone who thinks about these issues should be attentive to sexual health. As I will describe, this treatment of sexual health as a bridge to other concerns turns out to be not just the prerogative of those on the political left, but also may characterize those on the right. The ubiquity of sexual health. Two deceptively simple and ordinary words, spliced together in an unlikely pairing. The conjoining of sexual with health does an enormous amount of work, referencing a wide array of people and problems. At least since the 1970s, health professionals, researchers, governments, advocacy groups, foundations, and commercial interests increasingly have embarked on the quest for something called sexual health. Programs have been launched, organizations founded, initiatives funded, products sold. Yet, critical scrutiny has not kept pace with this flurry of activity. How and when did people come to imagine that there might be a form of health called sexual health? What might it mean to be sexually healthy or unhealthy? Which groups in society are deemed more or less capable of achieving sexual health? Why has the achievement and safeguarding of health become a relevant and unavoidable consideration when evaluating one's sexual desires, capacities, and behaviors? How did sexual health become the gateway to addressing a host of social harms and reimagining both private desires and public dreams? Sexual health, as I have already suggested, is a domain of action, investment, and intervention, undergirded by evidence as well as stories shaped by contingent historical developments like the AIDS epidemic, yet serving as a pathway to an ever-widening range of contemporary concerns. At stake are the very real health needs and personal desires of individuals around the world, as well as the interests of many corporations and professional groups. The happenings at the National Sexual Health Conference reveal at least a portion of the sweep of activities, the diverse scientific agendas, and the broad political, economic, intellectual, and practical stakes, all premised ultimately on the idea that there is a form of health called sexual health. That idea should not be taken for granted. While the precursors of what we now call sexual health can be traced back a ways, and I will do so in Chapter 1, the contemporary understandings of sexual health date essentially to 1974, when the WHO convened a panel of experts who proposed the term and offered a definition. Refashioned over the years, the working definition, as it is called, never officially claimed by the WHO, yet posted on its website all the same, now stands as follows. Sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. For sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected, and fulfilled. This, at least, is one definition of sexual health, an especially influential one, though not the only contender. Even on first glance, the definition seems all over the map, ranging, as noted, from the physical to the emotional to the mental to the social. It aligns with very contemporary emphases on promoting health and wellness, as expressed in regular exhortations from the human relations departments of today's corporations, but it treads far beyond the usual connotations of health, zooming off toward destinations that include pleasure, safety, freedom, and rights. Yet, for all its apparent capaciousness, even vagueness, the WHO definition fails to capture the remarkably varied ways in which people, groups, organizations, and governments have taken up the term or thought about the concept. However authoritative, this definition has not come close to resolving the question of what sexual health might mean. As a sexual health consultant in a department of sexual health at a UK hospital observed in the pages of a medical journal, no seminar or conference on the subject of sexual health seems complete without a presentation or debate rhetorically titled, "What is Sexual Health?" It seems that a defining feature of the discourse on sexual health, then, is the recurrent question of how to define it. Sexual health is the topic of thousands of scientific journal articles, and, according to Google, if one searches for the English-language term, about 41,900,000 web pages. The phrase appears in the names of professional associations, journals, research centers, treatment centers, conferences, protocols, and statistical surveys. The University of Michigan's School of Social Work offers a certificate program in sexual health. The University of Minnesota has an endowed chair in sexual health, as well as the Jocelyn Elders Chair in Sexual Health Education. Sexual health is a marketing category for selling products like vibrators and lubricants. It describes the agendas of agencies and governments. It is something that, according to a promotional campaign by Gilead, one may be encouraged to own by knowing one's HIV status. Sexual health also merits its own day on the calendar. September 4th is World Sexual Health Day, an event recognized by The WHO. Around the world, there are reports, agendas, agencies, and offices devoted explicitly to the promotion of sexual health, and the presence, absence, degree, or quality of sexual health is deemed a knowable characteristic of individuals, groups, and whole societies. A striking indication of the global salience of sexual health involves the new edition of the WHO's influential International Classification of Diseases, which goes into effect in 2022. The 55,000 health conditions coded in the ICD, the full gamut of human suffering of body and mind, will be grouped into just 26 chapters, and for the first time, one of those will be Conditions Related to Sexual Health. People seem increasingly to care about sexual health. People fight over sexual health. Even the attempts to ban the term during the Trump administration testify to its significance. That is, as I discuss in Chapter 9, the U.S. State Department, under Secretary of State Mike Pompeo, fomented controversy by seeking to proscribe the very use of phrases like sexual and reproductive health in international health policy documents. Reminiscent of how Victorian society, in the philosopher Michel Foucault's well-known account, spoke verbosely of its own silences about sexual matters, one of the things we now discuss about sexual health is whether we can discuss it. Yet, because sexual health is still so relatively new, but perhaps also because so much stigma continues to surround sexuality, the current hypervisibility of sexual health seems at times to coexist with its invisibility. I have learned through researching this book that many people have never heard the phrase and can only guess at its meaning. Sexual health lacks a Wikipedia page, and a search for the term on Wikipedia redirects automatically to reproductive health. In 2010, when two physicians published a call in JAMA for a national strategy to improve sexual health, they complained that sexual health does not appear once in more than the 1,000 pages of the Affordable Care Act. The National Library of Medicine did not assign a medical subject heading code to catalog sexual health until 2018. How can sexual health be both everywhere and nowhere at the same time? And how can we make sense of something that has those characteristics? The returns on an investment. This book provides an entryway into the distinctive worlds of sexual health. The chapters to follow traverse the distance between many venues. The research and treatment domains where sexual health is assessed, measured, and improved. The sex expos that invite attendees to leave their inhibitions at the door and explore today's top intimacy products. The headquarters of Focus on the Family, where the group's sexual health analyst explains what a healthy sexuality entails from a conservative Christian standpoint. The quest for sexual health turns out to encompass widely disparate agendas, and it comes to ground in relation to innumerable concerns, from sexual dysfunction to sexual violence, from HIV prevention to reproductive freedom to the practicalities of sexual contact in the COVID-19 pandemic. Rather than a thing apart, sexual health is intertwined with nearly every conceivable topical debate, more of them every day, which explains why sexual health has become ever more salient. For that reason, my point in writing this book is not just to survey these various worlds, as fascinating as they might be. Rather, I set out to show that the growing attention to something called sexual health matters, and that the generative idea of sexual health has carved out new and important routes by which people make sense of their lives and along which societies seek to organize themselves. The term sexual health signals a wide range of investments: financial, intellectual, practical, moral, and, of course, libidinal. It is also a concern of some urgency. When over 1 million cases of sexually transmitted infections, such as chlamydia, gonorrhea, and syphilis, are reported each day around the world, with the greatest burden of disease in those countries with the fewest resources to confront it, and when cases in the United States reached a record high in 2019, when nearly 2 million people become newly infected with HIV across the globe each year, when the rise of the #MeToo movement has ruptured the long silence surrounding sexual harassment and assault in the United States, when the debate over access to abortion and birth control casts a shadow across the terrain of domestic politics in the United States as well as its foreign policy, and when the global market in sexual wellness products was estimated at nearly $75 billion in 2019, there can be little doubt that the question of what it might mean for sexuality to be healthy is increasingly unavoidable. Yet the consequences of these various investments in something called sexual health spill out beyond the domains of immediate topical concern. I argue that sexual health has been put to use in ways that give form to how we imagine what it means to be a citizen, achieve happiness or well-being, secure social order, or work collectively toward a better future for the society. What is at stake here exceeds the domains of both sexuality and health. Promoting sexual health, I suggest, proves surprisingly valuable on the way to other goals. Following the assertion that the burgeoning attention to sexual health is more consequential than generally recognized, it might be expected that I would immediately pronounce on whether the undertaking of activities under the banner of sexual health is therefore to be judged as being either good or bad. Yet I maintain that we cannot and should not make such broad declarations. Indeed, sexual health has come to mean so many different things that blanket assessments are unhelpful and misleading. We need instead to consider the many alternative possibilities, as well as the tensions that lie embedded within the idea of sexual health. As will become clear, the proponents of sexual health have directed attention, marshaled resources, and propelled action in ways that are easy to applaud. Most immediately, they have championed sexuality as something important and valued, conferring legitimacy on a core dimension of experience that too often remains stigmatized and feared, and they have promoted better cures and techniques of prevention for a host of unwanted outcomes. In the face of devastating diseases such as HIV/AIDS, sexual health initiatives are life-affirming and essential. These efforts have also helped to install a new vision of doctoring, however imperfectly realized to date, that includes attention to sexual matters. And they have given license to new voices, expanding our conception of who might constitute a credible expert about matters relating to sexual desires and health needs. At a broader level, sexual health projects have expanded popular understandings of what may be encompassed under notions of human rights and social justice. Such efforts do more than cure disease, as important as that may be.
Sample complete. Ready to continue?